notice
that I ain't going
nowhere.
I ain't blowing no smoke. I mean, I've been sober, but you should've known it, that I wasn't going.
Right, so hello guys, welcome back to another video. Welcome back to my channel. Here are and Steph. So in today's video, I'll be talking about heart failure, or what we call congestive heart failure. So heart failure is a long-term condition that happens when your heart cannot pump blood well enough to give your body a normal blood supply. Your heart is still working, but because it cannot handle the amount of blood it should, blood builds up in other parts of your body. And most of the time it collects in your lungs, your legs, and your feet. So think of it like a warehouse that can't keep up with getting all the shipments where they need to go. The warehouse is always running behind and things pile up and they cause issues. So it's the same with the heart. It keeps pumping, but the blood, it's not able to pump the amount of blood that it needs, and then it pulls in other parts of your body, right? So we have left-sided heart failure, and this occurs when the heart loses its ability to pump blood. The left side of the heart normally receives oxygen, rich blood from your lungs, and delivers it to the rest of your body. So imagine when that part of the heart fails. Left-sided heart failure normally leads to right-sided heart failure and organ damage. And we can appreciate why, because the left side of the heart does most of the work. So some symptoms of heart failure would include, you would see patients present with shortness of breath, feeling that you cannot get enough air into your lungs, so they feel like they are drowning in their own fluid. They may present with chest pain, heart palpitations, swelling in the ankles, the legs, the abdomen, and also weight gain. So what are some causes of heart failure? So pre-existing coronary artery diseases such as heart attack, that can cause heart failure, diabetes, and we are back at diabetes again, and high blood pressure, and again we are back at high blood pressure. So most of the time the root cause of many of the other conditions in the body starts from high blood pressure and diabetes. Alcohol use, recreational drugs, and tobacco. So these are just some of the causes. There are many more as well. So when your left ventricle isn't working correctly, it allows blood to back up. What are some risk factors that predisposes a person to heart failure? So being older than 65, having an inactive lifestyle, you don't do any form of exercise, especially persons that they work at a desk, so they will sit most of the day and they don't do any walks or stretches, or so a sedentary lifestyle. Having a high blood pressure, and also a family history. So what are some of the treatments then for heart failure? So number one, as I was speaking about the diabetes and high blood pressure, lifestyle changes would be the first treatment for heart failure, including eating a healthy diet, exercising regularly, and stop smoking. Also, there are devices that can be implanted in your chest to help control your heart rhythm, such as a pacemaker. We can do surgery such as a bypass. And most people with heart failure, they are treated with medication, often 2 or 3 different types of medication. I won't go into details into how these medications work, because of course the are different medications, and they work in different ways. So you have the ACE inhibitors, you have beta blockers such as bisoprolol, you have diuretics such as the furosemide. Many persons would know furosemide, or what we call Lasix. And we also have digoxin as well. Most persons would know digoxin. So yes, this was just a short tutorial on heart failure. For any comments or questions, you can leave them in the comment section below. But thank you for watching, and see you in the next video.